Sharing your commitment to fight serious disease. Elekta is the company you've turned to for over 50 years when you want the most advanced technology. Putting the best weapons in the best hands, Elekta gives you the power to improve patient care. We've got the proof, and we'd like to share it with you. The latest example of our commitment to the industry is Elekta Synergy. Elekta was the first company to introduce an integrated platform that combines state-of-the-art 3D imaging with the most advanced digitally controlled treatment delivery. The response has been overwhelmingly positive since we unveiled Elekta Synergy at Astro 2003. Even the other manufacturers are following Elekta's lead again. Elekta Synergy breaks down the barriers between imaging and treatment delivery, bringing these two critical components together in a single powerful system. Designed from the ground up, Elekta Synergy represents a complete, robust, and forward-looking solution, enabling clinicians to deliver true image-guided radiation therapy. It's image-guided radiotherapy that will drive improved outcomes and better quality of life for your patients, not increasingly complex IMRT or MLC designs. Elekta Synergy gives you a more accurate means to know precisely where the target is at the time of treatment, and the ability to customize your treatment to each individual patient. Working closely with clinicians, we've already made significant progress in narrowing the uncertainties, overcoming patient setup errors and organ movement. Elekta Synergy helps you identify where the target is at the time of treatment and track movement during delivery. Now you'll have this critical information at your fingertips so you can compensate, make any necessary corrections to patient position, or adapt the treatment plan, and then verify that the adjustment you make is the correct one. All this accuracy inspires greater clinical confidence, allowing you to aggressively fight the disease by maximizing the dose to target volume while sparing the healthy surrounding tissue and reducing toxicity. Elekta Synergy features an integrated kilovoltage X-ray volume imager, or XVI, and its detector, as well as an iView GT portal imager for conventional megavoltage imaging. With this unique configuration, you can even perform high-contrast KV imaging simultaneous to treatment delivery. These devices stow completely out of the way for conventional radiation therapy treatments and can be easily redeployed. There's absolutely no compromise in staff access for setup or safe patient clearance. The unique gantry drum design of Elekta Synergy is ideal for integrating kilovoltage imaging, offering your practice an extremely stable and reliable platform. And the XVI of Elekta Synergy acquires images for any region of interest, from head to toe. Elekta Synergy offers 4D adaptive IGRT, the flexibility to choose the most appropriate method for image acquisition: planar view, motion view, and volume view, depending on your patient, your caseload, and protocols. Utilizing a simple radiographic mode, you obtain a high-resolution, high-contrast 2D radiograph. These simple snapshots capture images orthogonally or from any gantry angle. We call this rudimentary application of IGRT planar view. The X-ray volume imager of Elekta Synergy can also acquire a rapid series of lower-dose sequential images that reveal what the target is doing in real time. With motion view, you can identify whether the target moves out of the prescription margin at any time during treatment, due to respiration or other internal organ motion. Elekta Synergy helps you overcome the limitations of 2D static orthogonal imaging and sole dependence on bony or fiducial landmarks. In many cases, clinicians need true three-dimensional information about the target. You want soft tissue information to determine where the tumor is in specific relation to other organs and structures, and whether the target may be subject to movement during treatment, either inter or intra-fractionally. Vital information to maximize clinical confidence and ensure the most effective treatment. Information that static 2D images simply can't provide. The real power of 4D adaptive IGRT is volume view, the ultimate in true three-dimensional imaging at the point of treatment. Instead of two static images, the X-ray volume imager of Elekta Synergy sweeps around the entire patient, acquiring detailed soft tissue information using cone beam technology, providing a full 3D view of the target with precise high-resolution images of the surrounding tissue and organs. It's like having a CT scanner built into your linear accelerator. The raw image data is quickly reconstructed as a whole volume, so there are no slices to put together or resulting artifacts. The volumetric image information is quickly displayed on the XVI workstation, where a therapist or physician reviews the images. Using online interventional techniques, clinicians then align the volume view images with the original CT treatment plan information. You overlay and register both three-dimensional image sets and evaluate the accuracy of setup in all three planes. Using manual or automatic functions, the system identifies any geometric error and indicates the required table correction. You then make the needed adjustment in the patient's position or adapt the treatment plan accordingly. Table offsets using the assisted setup function transfer directly into the table control system to reposition the treatment table to sub-millimeter accuracy for precise treatment delivery. You'll find this online interventional treatment fast, accurate, and simple. Clinicians at the Netherlands Cancer Institute in Amsterdam report Elekta Synergy offers a much more accurate means to verify patient setup. By employing volume view in place of traditional orthogonal imaging prior to treatment delivery, they have significantly reduced setup errors. And because clinicians face a variety of workflow situations, we designed Elekta Synergy to offer the highest degree of flexibility. Some centers are looking at offline adaptive capabilities. For example, physicians at William Beaumont Hospital in the U.S. are evaluating volume view images over a period of days at the beginning of treatment for prostate patients, and making necessary adjustments to the treatment plan that often allow them to reduce margins. With Elekta Synergy, 4D adaptive IGRT is making a real impact in clinical settings today, helping you and your colleagues improve patient care. See the compelling evidence, see the proof, examine the outstanding image quality, and see how the expanded capabilities of Elekta Synergy fit into your current workflow practices. We also invite you to review the many scientific presentations from your colleagues who are already using Elekta Synergy. When you do, we think you'll agree that no other company has done more to increase the accuracy and effectiveness of the tools you use today and the ones you'll be using tomorrow. Elekta gives you the power to see better, to plan better, and as a result, to treat better. For more information, contact your local Elekta representative. They'll be happy to answer any questions you may have.